And the incidence of major depression, which is more increasing nowadays among the younger people, and that is around 20 years of age.
Hello and welcome to Doctor Story, everyone. At least once in a lifetime, we all must have used the word depression, isn't it? But is depression just about feeling down or having a rough patch? Or there are other aspects you must know about this condition? The practitioner and expert for today is Dr. Praveen Jose, MBBS and MD Psychiatry with more than 6 years of experience. Currently associated with Anaamaya Hospital, Payyanur district in Kerala. Dr. Praveen, we happily welcome you to Doctor Story.
Thank you.
So, doctor, what according to you, people generally think depression is and what it is actually?
Okay, depression, it's a mood disorder that causes persistent feeling of sadness and loss of interest in doing routine pleasurable activities. So generally people come to my clinic telling that they are having loss of interest in daily activities, like they are not able to watch TV or enjoy music, or not feeling like cooking, not feeling like going for a walk, not feeling like talking to others, or not able to concentrate in their work, or they may be having some biological problems like disturbance in the sleep or diminished appetite, or something that which they used to feel very happy in their earlier days. And such people, they come with having such problems like loss of interest, or diminished sleep, or decreased appetite, or decreased interest in routine activities, or easy fatiguability, decreased concentration, or loss of pessimistic views of the future. Or some patients, they'll be complaining of some other symptoms, like they'll be feeling helpless, or they'll be feeling hopeless, or they'll be feeling like worthless. It may be due to certain circumstances, or it may be due to some stressful conditions, or it may be due to loss of partner, unemployment, financial difficulties, family issues, or difficulty in studies, or problems with their spouse, problem with other family members, like that.
So, doctor, in what age do you see people affected by depression the most? And also, is it more prevalent in women than men?
Okay, mean age of onset of major depression, it's around 40 years, with about 50% of all patients having onset of symptoms between the ages of 20 and 50 years. And depression also, it can begin in the childhood or in the older age. And the incidence of major depression, it is more increasing nowadays among the younger people, and that is around 20 years of age, mainly due to increasing alcohol or any other drug abuse. And lifetime risk of depression, in males it is around 8 to 12%, and in females it is around 20 to 25%. However, lifetime risk of major depression in total it's around 10%. And there is also some reasons for major differences between the depression in males as well as females, mainly because of hormonal variations, effects of childbirth, differing psychosocial stresses for women and for men, etc. like that.
So, doctor, how does someone know whether they are just feeling down, like it's temporary, or they actually have depression? If you could highlight some most common signs of depression for us.
Okay, mostly people come with a variety of complaints, like they have depressed mood or loss of interest, reduced energy leading to increased fatigability and diminished activity, or decreased concentration and attention in doing daily routine activities, decreased self-esteem, decreased self-confidence, ideas of guilt and worthlessness, ideas of self-harm or suicide, decreased sleep, and diminished appetite. The most important feature for depression is sadness of mood or loss of interest in all their activities. Loss of interest in activities results in social withdrawal and decreased ability to function in their occupational and their interpersonal areas. Sadness of mood always, most of the times, results in helplessness. That is, there is no help in their present condition, or hopelessness. That is, there is no hope in their near future, or worthlessness. That is, feeling of inadequacy and inferiority. Disturbance of the biological function like insomnia or diminished appetite. About 15 to 20% of the depressed patients have other psychotic features like delusion, hallucination, or other inappropriate behavior. We have to assess the patient, we have to speak to them, understand their problems, and you have to diagnose whether it is depression or just it's a adjustment problem with their present life circumstance, and we have to treat them accordingly.
Where does this stem from, all of this? Is it just a thought process of that causes depression, or like there are more dark causes to it?
Okay, there are many different factors other than the thought process that may cause depression. So as per the studies, the first important factor for depression, it can be due to certain biological factors such as abnormalities in certain neurotransmitters like dopamine, serotonin, norepinephrine, etc. So when there is decrease in the level of neurotransmitters, there will be decreased interconnection between the neurons, and which results in tiredness or weakness of the body or low mood, loss of energy, etc. And another factor for depression, it may be due to genetic factors. That studies have shown that if one parent has a mood disorder, then there is high possibility that child will have the risk of getting depression in between 10 to 25% of getting mood disorder. And more the members of the family are being depressed, there are chances that higher the risk for the child. And another cause for depression, it may be due to certain stressful life conditions. It may be losing a parent in early age, or certain environmental stresses like associated with onset of symptoms like loss of spouse. Another risk factor for this may be due to unemployment. And another factor for causing depression, it may be due to premorbid personality. Like certain people will be having certain types of personality, and mostly people with histrionic personality or obsessive compulsive personality and borderline personality, there is greater risk of being depressed. And another factor for depression is getting depression is substance misuse. That is effect of certain narcotic drugs or use of alcohol. It may also lead to depression.
So, doctor, medically, how is depression diagnosed? Like, what are the examination or test involved?
See, for diagnosing any psychiatric illness, not only depression, for any psychiatric illness, we don't have any test for doing for telling that this is depression, this is anxiety, this is psychosis, this is BPD. It comes through experience. It comes through mental status examination. And there is no machinery or no equipments for diagnosing all this psychiatric illness. So before we have to do a detailed mental status examination or detailed interview, and getting the first we have to start with the patient's basic identification data. That is patient's name, age, sex, marital status, education, occupation, socioeconomic status, and then we have to then the patient has to tell his problems regarding his emotions, his or her emotions, regarding their feelings, regarding his biological functions, whether their daily routine activities are disturbed or not, whether the patient is having any suicidal tendency, or whether the patient is having any substance use, whether they are having any family history of psychiatric illness or past history of psychiatric treatment in the past, and everything should be discussed in detail. And during interview, patient should be put in ease, and then there should be an empathetic relationship with the patient. And most important interviewing skill in this regard is listening capacity. We have to listen very carefully to the patient and demonstrating that we are interested in listening and attending to his personal problems. Listening is not only active but also a passive process. And confidentiality should be maintained. And some additional points but what we have to take while doing a mental status examination is we have to consider the onset of illness, the duration of illness, the course of illness, and whether there is any predisposing factors, whether there is any perpetuating factors or any other relieving factors. And before starting the interview with the patient, it is better that we first interview with the any bystander or informant to know the patient's premorbid personality, whether he is having any substance use, whether he is going for job, whether he is doing his daily routine activities, whether he is having any other illness. So regarding to get a detailed information of that, it is better that we talk to the informant or bystander of the patient.
How do you actually treat it once we have diagnosed it? How is the treatment? If you could help us go through the treatment process step by step, or if you could verbalize a case study for us.
For any type of depression, if once clinically if it is diagnosed, after talking to the patient, after talking to the informant and doing mental status examination, once the diagnosis of depression is made, we have to treat the patient. And obviously for treating depression, antidepressants is the drug of choice. There are many different types of antidepressants like SSRI, SNRI, monoamine oxidase inhibitors, tricyclic antidepressants, dopamine reuptake inhibitors like that. It may take around 3 to 4 weeks to exert a significant effect in the patient. And choice of antidepressant, it depends on the side effect profile of the antidepressant, temperament of the patient, and lifestyle status of the patient. And regarding the treatment, there are 3 main phases of the treatment. First phase is acute treatment. That is till remission occurs. That is remission of symptoms occurs. Second phase is continuation treatment. That is from remission till end of treatment. And last stage is maintenance treatment. That is to prevent further recurrences of depressive episodes. Maintenance treatment may be indicated in partial response to acute treatment or poor symptom control even after the treatment is started, or in case of certain cases like chronic depression. And 20 to 35% of the depressive patients are refractory to antidepressant medication. In such cases, we have to consider changing this antidepressant medication or augmentation with antipsychotics, augmentation with other antidepressants, or if the patient is not responding at all, then we have to consider that the last option is we have to consider electroconvulsive therapy, also known as ECT.
Apart from the antidepressants, are there also different therapies that are used to treat patients?
Yeah, apart from antidepressants, there are different therapies which may be helpful in depressed patients with mild to moderate cases of depression, which I earlier mentioned. In mild to moderate cases of depression, we just need therapy for the patient. And there are different therapies. First one is CBT, also known as cognitive behavior therapy. It aims at correcting depressive negative cognitions such as hopelessness, worthlessness, helplessness. It is useful in mild to moderate cases of depression. Another therapy is interpersonal therapy. That is to recognize and explore interpersonal stresses or any role disputes, social isolation, social skill deficit. That is the main effect of interpersonal therapy. Next therapy is psychoanalytic psychotherapy. That is, it aims at change of personality itself rather than changing the symptoms. Next coming is behavior therapy. That is social skill training, problem solving techniques, assertiveness training, self-control therapy, activity scheduling, or decision making techniques. Next is group therapy. This may be useful for a group of people who are having mild to moderate symptoms of depression. Next one is family therapy and marital therapy. It is educating the family about the course and progress of the illness of the patient. And it is also useful in somatic symptoms of a certain depressed patient. It helps in reducing the intrafamilial and interpersonal difficulties and to reduce and modify certain stressors.
So, doctor, how do we help someone who we think has depression? Like listening to you, seeing this video, if someone thinks, okay, my friend or my colleague or someone he or she knows has depression, how can he aid in such situation?
See, if a person feels that his friend or his family member is having depression, there may be certain symptoms in him or her. Like they'll be not doing their daily routine activities. They won't be speaking much. They'll be socially withdrawn. They have reduced concentration in doing their daily activities. Some people, especially in the youth, they'll be watching TV. They'll be playing games. They'll be playing cricket or football. But after being depressed, they may not be playing. They may be isolated from their friends. Or if it's a girl, she might be going for shopping with her friends or going for a movie, going for a coffee. But once she is having depression, she won't be going outside. She will be socially withdrawn. She will be staying in her hostel or her house. So in such conditions, when her friends or family members not there, she is socially withdrawn. It's better to ask her what is her problem, what made her to be in this present condition. Ask her if she is having any stresses or any difficult life circumstances. If she is telling that she can't concentrate, or she is having persistent low mood, or she is not able to eat, not able to sleep, having some suicidal tendencies, or having some worthlessness of their life, or hopelessness for their life, then in such condition, she has to be taken to a mental health professional. As I told earlier, if it is a mild to moderate condition, just counseling or therapy done by a clinical psychologist is sufficient. But if it is a case of severe depression, if the patient is not eating food at all, not having sleep at all, not talking to anyone, most of the time lying on the bed, and totally withdrawn from her daily routine activities, in such conditions, they have to take the patient to a psychiatrist, and she has to be treated medically.
We couldn't thank you enough for the time you took off for us today. We truly appreciate your suggestions and the phenomenal work that you're doing, aiding such mental health issues. A big thank you from all of us.
If you have any problem, or if those who are watching this video, if any of your friends or any of your family members feel like they are having depression or having this depressed mood, kindly consult a mental health professional for their mental well-being.